All right. Bellevue, awesome. Yeah, so excited to have you guys here. Excited to talk about birth prep. Lower your camera so you can see the top of your head better. Perfect. Thank you for that tip. Lovely. All right. There we go. Awesome. I know we have some doulas on and we have some pregnant people on. So if anyone wants to just drop in and say how far along they are, and that's kind of fun to do. Maybe where you're also planning to birth. That would be exciting to see if you feel like sharing. All right. Cool. So we have about 20 people on. Yay, Meredith. I'm so happy for you. 16 weeks. That's cool. Awesome. 38. Awesome. Birth Center, Evergreen Hospital. Lovely. Fun. Due date was yesterday. Carla, good. This is going to be fun information for you. Swedish First Hill, Providence. Awesome. Well, thanks for sharing. This is great. Okay, so I'm Dr. Allison Felt, and you are currently on the Birth Prep webinar. And this is everything you need to know to prepare your body for birth. So we're talking everything pelvic floor. We're going to go over some changes that happen during pregnancy and body mechanic type stuff. Some of this stuff was covered on the Welcome to Your Pregnant Body webinar, if you were there. And so that piece of this might be a little bit different, but we will talk specifically a lot about preparing, practicing for pushing, practicing your breath patterns and things like that. The reason it's important and what muscles need to be working in order to help you be a little bit more effective with your birth. Now, I am currently pregnant myself. I am 29 weeks and I am birthing at home this time. My first 2 births were hospital births as well. So just thought I would share that information. And when you see me giving these demonstrations, I will be pregnant representation. So here we go. This is my lovely team here at Body Motion Physical Therapy. We are located in downtown Edmonds, Washington. We have Dr. Victoria, Dr. Riley, Isabel, and Devin, and sometimes our office dog, Bucky, who joins us. So we're really excited to be here. My staff is here. You might have heard from them. They'll give you a ring to tell you about the webinar. We sent out a questionnaire and I got a lot of responses from that. So that was great. So we'll talk a little bit about some aches and pains as well and how to manage those. Those were some of people's questions. So you might hear from them. We also offer 30-minute discovery visits. So those are just complimentary discovery consultations for anyone who is pregnant or expecting and or postpartum, just to really help you find out where you are in your journey, what you've experienced yourself, your body, and what needs to happen for you to live your best life and really feel the best in your body. So also what needs to happen for you to have the birth that you want to have, or prepare your body as best you can for the birth you want to have. We all know that birth is unexpected. So there's sometimes that we can't control the outcome, but there's a lot of things that we can do. And so this is all about what we can do. And it's hard for me to even say this because for me, part of like my journey also is just having an open mind about what can happen, but having very clear expectations of what I want to happen. So I am empowered through my journey. And that's what I want you to feel is empowered through your journey. And you can always be ready for the unexpected, but still have a very clear plan of what you want to have happen. Okay, so, oh, and Devin dropped in the chat too. I hope you guys can see the chat, other people's chats. But there is a link for a free discovery visit if you're interested. So just some of the things that our clients say about birth, about when they do the birth prep with us and work with their pelvic floor and learn how to use their pelvic floor muscles, is they're having much faster pushing times. They often find that birth is more comfortable, and they're comparing that to their first time usually. And the reason is they feel like they've already felt some of that burning sensation. They already know what it feels like to feel the ring of fire, is what we hear sometimes, because they know what it feels like for their pelvic floor to stretch. So we're going to talk a lot around that. before I, do I save this for later? I have a little tidbit about this later, but before I was really working with people, birthing people, working on the inside of their pelvis, so that's working on the inside of the pelvic floor, we did a lot of techniques on the external pelvic floor and external pelvis and body. And that's what most physical therapists do. That's what most pregnant PTs do. So if you go to a physical therapist while pregnant, you'll get a lot of treatment for the external body. However, when I was treating that way, we were still having about 30% C-section rate. And that's not ideal. And so when we started really working on the inside of the pelvis and incorporating that to the external pelvis, it was a game changer. And I can't even tell you how many people that come to us have vaginal deliveries. And it's hard to measure the success, but it's pretty cool. And to know that like we can empower people to give these kind of births and really know how to use their bodies going into birth, I think is super special. So you're on the right track. Thank you for being here. And I'm excited to teach you about this today. So we'll go through a little bit of the anatomy and the changes that happen during pregnancy. Then we're going to talk about core. I'm going to go through some posture stuff and some body mechanics. All of this is to help protect the pelvic floor and protect the core muscles themselves. So that's why it's important. Some of it's kind of boring, but I'm going to teach it anyways, just as a protection for pelvic floor. And then we'll talk about the importance of pelvic floor preparation, and we'll talk about some rituals that you can integrate into your routine and start practicing today. So, and then some normal postpartum healing times. We'll just touch on that briefly. So, any questions so far? Need me to slow down? Anything like that, drop it in the chat. Great. This next part is you can do it with me. If you want to go ahead and stand up. I can't see you guys since we're on webinar. For privacy reasons, we decided to do it that way. So I am going to stand. Devin, if you can just let me know in the chat that you can hear me without those headphones, that'd be awesome. Beautiful. Cool. So just some general changes that happen in the body during pregnancy is head goes forward, and a lot of times our shoulders will hunch over. This is a little bit of exaggeration, but these are some common positions. A lot of times they'll become an arch in the back. So we'll get a big arch here. Our pelvis might dump forward and our knees might go into hyperextension. And so these are just the common patterns that we fall into when we're not using our core muscles. So the first thing that you can start to do, and the reason this is important is because this is going to help protect your pelvic floor. And we'll talk about why in just a little bit. But the very first thing is your neck is actually connected to your pelvis too. So bringing your neck and head over your shoulders. So your ears line up with your shoulders. Not many people like to do this. It's not a very attractive position. It might give you a double chin like it does myself, but it's the safest place for your neck to be. So to practice some of that, and then pulling your shoulders down and back into your back pockets is a great posture technique as well, just to keep your spine completely aligned. And that's important when we have all this relaxin and progesterone in our body that is causing some laxity in the joints. And that laxity, so that looseness that can happen, can predispose us to certain injuries like hurting our knee, spraining our ankle, low back pain, and things like that. So this posture stuff becomes pretty important. As far as that like arch in the back that happens when we just hang out on our ligaments, it's important to focus on pulling baby in, imagining like you're pulling your head up to the sky like you're on a string, and that keeps your core engaged. And that will also just automatically take your knees out of that hyperextension place. So that's just a little bit on posture. And it's a constant work in progress. Easier said than done from experience. So, all right, this slide is a busy slide. We'll just go through it briefly. But everybody with me still? Any questions on posture? Awesome. Okay. So as we grow during pregnancy, our muscles will lengthen. Therefore, when the abdominal wall, so your belly gets bigger, your core muscles stretch. So when they stretch like that, they become weaker. Also, you have this muscle called the diaphragm, and it lives underneath the rib cage. So here's your rib cage and your diaphragm that helps with breathing. Um, it it gets weaker as well because it actually gets longer. The ribs flare during pregnancy and the diaphragm lengthens. And so this is a really important muscle, especially for your core, especially for birthing, for labor and birth. And so we're going to talk about the importance of breathing using your diaphragm. And let's talk about that here. And then we'll connect this to our pelvic floor in a later slide. But the first thing I want you to do is to put a hand on your chest and put one on your belly. We're going to take a nice deep breath into our diaphragm, and we're not going to use our chest. So you're going to take a nice deep breath. Your belly is going to expand and your ribs are going to flare just a little bit. So you're going to inhale, belly expands, ribs flare. Exhale, let everything go. We're trying to keep the neck and chest relaxed when we're breathing like that. So we're inhaling into belly. So as you get bigger, the baby's in the way, right? The diaphragm can't go as low and the diaphragm's weaker. So to keep that muscle tuned up, I say to intentionally breathe like this 5 minutes a day. It's really good to keep that muscle in check. You want this muscle to stay strong because during your labor, if you can tune into breathing like this and using that muscle, you're going to help push down on the top of the uterus, and you're going to, because this muscle, as you contract it, it inhales, it goes down, and that is going to help push down on the top of the uterus, which is going to help open the cervix more. So through your contractions, if you're breathing, we teach a lot about breathing the baby out, and it's using your breath to help push down on the top of the uterus, which is going to help make these contractions productive for you. We're going to tie this to the pelvic floor in just a little bit, but that is one of the tips here. So breathe 5 minutes a day. Easier said than done too. You have to actually make time for that. And I'm so guilty of that myself, but doing my best now, especially that I'm almost 30 weeks. So here's a pelvis. It's a picture of a pelvis. And here is what we call the pelvic symphysis. So it's the center of the pelvis. It connects the two sides. During pregnancy itself, you get about 5 to 7 millimeters of separation here. During delivery, that can go all the way up to 9 centimeters. And so we want to protect that joint so it's not painful. Sometimes if that joint is painful during pregnancy, it's called pubic symphysis dysfunction. When there's pain in this joint, or when there's pain in the low back or on some of these sides of the back, those are called your SI joints, then we sometimes get what will happen is the pelvic floor will get very tight. Anytime there's pain, the pelvic floor is going to get tight and shorten. And so you want to get that addressed. If you're experiencing any of that, you want to get help. A pelvic expert physical therapist can help you with that, because that's going to help reduce some of that tightness within the pelvic floor. However, every single person who's pregnant who is going to experience some degree of separation here. Now, the pelvic floor in response to that often tightens. So we think of the pelvic floor as elongating during birth and pregnancy, because that's what should be happening. But anytime there's pain, or if we aren't really strong in our glute muscles, or if we don't have a really strong core going into it, most of the time the pelvic floor is just going to grip to try and hold the pelvis together so it doesn't fall apart during the entire pregnancy. And so we need to teach it to open and lengthen. And that is going to help allow the baby's head and body to come out of the vaginal canal, so come out of the pelvic floor. So we'll talk a little bit about that. I mentioned briefly how the core muscles expand and elongate. And those are just some of the names: transverse abdominis, rectus abdominis, oblique muscles. Those are important to know too. And then we talked about the ligament laxity. And so that laxity is allowing the pelvis to separate, but it does predispose us to more injury during pregnancy. And so it is important to keep your core strong and stay strong during pregnancy to help decrease some of that pelvic floor tightness. Let's see here. Questions on that side at all? If you open and lengthen the pelvic floor the entire pregnancy, how do you prevent prolapsing in urinary incontinence? Beautiful question. Thank you so much for asking this first off. That is such a great question. So typically, people are actually more symptomatic with urinary incontinence and pelvic organ prolapse when things are tighter and there's more pressure. Because when things are tighter, so if the pelvic floor is tighter, you're actually going to get like squeezing of the bladder and urethra, push more so than if things are open and things can just sit back in their regular spots. So most people are more symptomatic with prolapse or have more signs of prolapse when things are actually really tight. Same thing with urinary incontinence. When things are really tight is oftentimes when people are more incontinent. I know that's very counterintuitive, and there's a lot of pelvic PTs out there that do actually teach Kegels and really keeping things strong during pregnancy. But 99% of the time, what we see clinically is that things are just very tight and need to be relaxed. And then you'll have control to stop the flow of urine. But most women and people in female bodies walk around with very tight pelvic floors, and there's weakness in the tightness, but that's actually what's causing the symptom itself and not because it's weak. So does that make sense? If it doesn't, type into the chat and I'll go through it again. But those are really good questions. People who have the most dynamic pelvic floors, meaning they can really open and lengthen their pelvic floors, means that they'll be able to contract it without even doing Kegels or exercises specifically for the pelvic floor. Technically, you really shouldn't have to be doing Kegels ever. If you know how to use your core and your pelvic floor, you automatically will use it during the right activities. So maybe picking your kid up off the floor, or bending forward, or getting out of the car, or sneezing and coughing. And so it shouldn't be like I have to Kegel when I do these things. It should just be like, oh, my pelvic floor is moving with that activity. I know that's different than what's out there a lot, but that's important to know. So that makes sense. If the pelvic floor is lengthened and loose, is there any risk of preterm labor? No, not that we've seen ever. Nope. And I don't know I've never seen research on that. But it's not that it's loose and lengthened. It's more so that it's just in a healthy, good place that it should be. And I say it's loose and lengthened compared to most of the population that walk around very tense and tight. So that's that. Okay, so we're going to go over activities to protect your body, just some simple body mechanics. And again, this is just about protecting the pelvic floor, protecting the organs to stay inside your body. I'm going to give a little example of the core here. So if your core is a pop can, there's this really good pressure within the pop can. The bottom is your pelvic floor. The front is your abdominal wall. The back is some back muscles and your butt muscles. The top is your diaphragm. As you get bigger, the pressure can increase and change. With that change comes weakness. So that's like popping the top to the pop can. When the top is not popped, we can't really squish the can. But the minute it's popped is the minute that we lose our natural pressures. So with pregnancy, we lose our natural core pressure that keeps us nice and strong. We also don't just get it back postpartum. It's something you have to retrain your core to do, is to get that nice pressure back. And so this is an example. So the core, when you're pregnant, you can think of it as being just more, it's weaker. And the pop can is a good example. So it's not just weaker, but it's also the pressure is different. And we want the pressures to maintain, we want them to be good. And that will help keep our organs in place. So we prevent prolapse. That will help prevent diastasis, which is the separation of the abdominal wall. And so doing these adaptations is really important because it's going to help prevent some of those injuries. So here we go. Before I start this, one thing I forgot to mention in the posture sides is, so your lower abdominal wall is called your transverse abdominis. It's actually throughout your entire abdominal wall. But if you think about pulling the baby up to your belly button and engaging that muscle there, that's called activating your transverse abdominis. In turn, that's going to help lift the bladder. There's a ligament that goes from belly button to bladder. It's going to help keep that elevated. The uterus sits on top of the bladder, so it's going to help keep it all elevated. So activating that transverse abdominis is really important to keeping those organs safe and keeping them in place. So that's the first thing I want to say. The second thing is when we go through these exercises or adaptations, I want that muscle to lead your movement. And now to decrease the pressure that you might feel with this move, with different movements, you're going to exhale as you do these movements to help decrease the pressure on the lower pelvic organs. So getting in and out of a car, if this is my pretend car here, let's pretend this is my car. You want to sit your butt in the car and then keeping your legs semi-close together, bring one leg in and then the other. Same thing getting out. You want to bring one leg in, one leg out, and then the other. That's opposed to just like stepping in the car. I caught myself doing that this morning actually, which is so ironic because I was giving this today. And what you're doing here when you do that kind of modification is you're helping prevent any shearing of the pubic bone. So you're going to help prevent prevent pain in the pubic bone, so prevent a pubic symphysis dysfunction. So just to help keep your pelvis symmetrical, that's important. I'm going to go straight into sitting here. So when we talk about sitting postures while pregnant, a lot of us like to cross our legs, but that's not ideal for your pelvis because when you cross your legs, you're going to be pushing on one sit bone or another because your weight will shift when you do that. Even if you're just crossing at the bottom, so if your feet are just crossed. So it's important to sit with your feet about fist width apart, knees fist width apart, and sitting on your sit bones themselves. That's going to help the force so it's not just through one side or just through the other. And that will help, again, prevent some of that low back pain. So that was seated postures. We'll go over toileting on a different slide. Sleeping postures and getting in and out of bed. So I have my bed back here. So getting in bed. I didn't prepare my pillows. I forgot about that. So a couple things here. You want to have a pillow fortress. Pillow fortresses are good. They're protective for your body. They're going to help keep your spine as neutral as possible. If you sleep with your spine twisted or turned, you're more susceptible to injury when pregnant, just because of that laxity that you have in your ligaments. So here we go. Head down here. This pillow is too shallow for me. I did that too fast. So getting into bed, you're always going to roll onto your side and then come here. And then you can roll to the other side, but I'll teach that in just a second. The pillow setup here, always have something between your knees. If your knees come together, that's going to put a rotation through your pelvis, and that's going to just put more strain in the low back. So we want to take that strain off the back, keep something between your knees. We want your head to be in a good position, so it's not dropping down here or cocked up this way. So sometimes people find it beneficial to use a towel rolled up underneath their neck to help keep that alignment good. And then same thing here. You're just going to wrap a hand here. Depending where you're at in your pregnancy, it might be better for you to stick something or a little towel roll, or they sell those fancy pregnancy wedges. But I love the towel rolls because they're simple and reusable. You can just stick that underneath belly, and that will help prevent rotation in the spine. So if you're rotating onto your belly at night, that can cause more rotation through the spine. So those are some of the techniques and importance of sleeping mechanics. And then if you're rolling over in bed, one of the things you want to always do is you want to keep your spine as aligned as possible when you're rolling over. You'll bend one knee, and that knee will help you push and pull yourself over here. And then if I'm coming back this way, I will straighten one leg, the side I'm going to, and then I'll push with the bottom of my foot on this side. That's again going to be protective for your pubic bone. Rolling over in bed can get painful during pregnancy, especially if you have pubic bone pain. So those are some of the modifications. Let's talk about, let's see what's in the chat here. Perfect. Lauren, I'll come back to, or Laura, sorry. I'll come back to your questions there. And so when in pregnancy, is it critical to start these adaptations? Yeah, so it might sound silly, but actually it's critical to start these adaptations as soon as you can. So when you find out you're pregnant, relaxin, so the thing that makes your joints really loosey-goosey during pregnancy, that's gonna peak between 6 and 9 weeks, 6 and 12 weeks. I'm totally brain farting. That is my pregnant brain. It's around the first trimester that it's already peaked. So it kicks in the minute you get implantation. And so I would start these adaptations right away. If your body's been pregnant before, then you might feel more laxity quicker. But yeah, so start those adaptations right away. When in pregnancy / belly size, does it make sense to add a pillow for sleep? Yeah, anytime that I would say that you're showing, or to be honest, I had a belly before I was pregnant. And so I slept with something underneath my belly just to keep my spine aligned from the very beginning. So it just depends on if you're feeling like there's any rotation in your spine, or can you comfortably sleep within this neutral spine without being cocked one side or the other, or without the belly pulling you one forward more. Hopefully that makes sense there, Amy. And yeah, so a towel roll to me, or a towel support, is just something as simple as this thin. They sell those big fancy wedges, but don't think some people like them. And if you want to have big fancy wedges, totally cool, but don't need them to have the good support. I heard it's best to sleep on your left side. Yeah. If you sleep on the same side at night, is that bad? Same side night after night, is that bad? It can make things more stiff. You might wake up with your shoulders more stiff if you're not going from side to side, but some people, especially if you have a vasovagal response to being on your back, which means that sometimes people will get lightheaded. The concern is that you'll get compression of it's called your inferior vena cava. So it decreases the blood return to the heart. And so that's why people suggest always sleeping on the left side. So if that's not comfortable for you, there are modifications for different sleeping positions. But night after night of sleeping on your left, yeah, I would say that's not ideal. It's natural to move at night. And so to go to the right side to give the left shoulder and neck a break is good. But it's okay to spend the night on that side. Just wake up and make sure you stretch and get your body moving, because that's a long time. Hopefully you're sleeping 8 hours to be sleeping on that side. I said 8 hours, but really, like, a full sleep during pregnancy, is that possible? Cool. Okay, so this is fun. We're going to talk about the importance of pelvic floor preparation for birth. And it's really important that we talk about, I'm putting the headphones. It's important that we talk about the pelvic floor, because this is where the baby has to come out of. And it does not get enough street cred. Everybody knows to do acupuncture during pregnancy. Everybody knows to do chiropractic during pregnancy. Maybe you're seeing a massage therapist. It's good, but this is where the baby comes out of. So you need to treat this area. And now there's a caveat to that. Anyone who's on pelvic rest cannot be treated internally during pregnancy unless their doctor agrees with the plan with their provider. But for everyone else, it is absolutely imperative, in my opinion, to have internal pelvic floor therapy during pregnancy. And it goes along with what's happening externally. But the baby comes through the vagina. So here's pelvic floor. You have 3 holes. You have your urethra, you have your vagina, you have your anus. Okay, so female pelvic floor, where baby comes out of. So when you think about the head coming through here, the pelvic floor has to stretch massively in order to get this baby out here. So if you are preparing your pelvic floor by doing Kegels, that's just going to make things tighter. And like I said earlier, most people walk around with their pelvic floors already fully contracted. So most of the time, there's some level of like full on contraction when we assess people. And this is beyond pregnant people, but stress can be held within the pelvis, any history of low back pain, hip pain, incontinence, you name it, like that can cause pelvic floor tightness. And when the pelvic floor is tight, to do Kegels, so if this is my pelvic floor and I'm just going to sit here and do Kegels, it's not doing anything, because a healthy muscle would be working in the full range of motion here. Okay. So a healthy muscle would be able to fully relax. And most of the time, we can't get there. And now, if you're going into childbirth without being able to get that full relaxation, it's going to be really hard to get that baby out. And that's where we see like a lot of tearing happening. I mean, it's very, I don't know the stat on how many people tear. That would be a great research study. But it's a massive amount. We see it a lot, especially in hospital births, depending on how people are cued to push. We will talk about that a little bit coming up here. But so pelvic floor, this is healthy pelvic floor. A healthy pelvic floor is able to contract all the way, able to relax all the way, and it's able to bulge. So go into some, what would be here, hyperextension, just some overstretching. And the healthy muscle can do that without actually tearing. So when our muscles are really tight like that, we decrease the blood flow, the tissue becomes more fibrotic. You can imagine like a healthy pelvic floor feels like a juicy steak. A not healthy pelvic floor or a really tight pelvic floor with a limited blood flow feels more like beef jerky. And so the goal is to have a healthy pelvic floor, have that muscle that can contract and relax. So I'm sorry for the food analogy, but that is kind of the best way I can think of to describe what a healthy pelvic floor is like. So the goal going into delivery is to like get that nice nice steak feel of the pelvic floor where it can fully relax, fully bulge and overstretch and fully contract. So if you're doing Kegels, I would just say maybe reconsider and think about finding ways to open your pelvic floor and find new lengths to the pelvic floor. All right, so here we go with a little bit of tying our breath patterns to our pelvic floor. So here's pelvic floor. It sits between your sit bones. Some people have a better connection to your anus. Some people might feel a better connection to the vulva or to the labia. Some people might have better connection to the clitoris. So you're going to have to figure that out yourself. I'm going to talk you through different verbal cues, but you can play with it. So you're sitting on your sit bones, nice and tall. We're going to take a nice deep breath into the belly. My diaphragm is going down deep, pushing on uterus a little bit. What should be happening when I take that nice deep breath inhale? My pelvic floor should be opening and falling to the floor. As I exhale, I'm naturally going to get my diaphragm comes back up and my pelvic floor comes back up. So here I am, I'm going to inhale. Pelvic floor goes down, diaphragm is going down with that. They move concurrently or should. And so how I want you to start to feel this is you can either, if you're comfortable at home, no one's on video here, you can either place a finger inside your vagina, on the outside of your vulva, and you want to feel relaxation. You want to feel opening. And now this is not a pushing or a straining at all. This is just natural physiological movement that should be happening. However, when our pelvic floors are really tight, it's hard to feel that natural opening. I'm just going to like preface this. The reason pelvic floor therapy is so important is because it's hard to get that sensation without someone assisting you in that mental connection to the muscle. And the people that have this connection before they go into menopause have much better times at staying continent and not having issues associated with incontinence, painful intercourse as they go through menopause. And so it's the earlier you address this and get this connection, the better. And of course, doing it during pregnancy is going to help with the birthing process. So that's just a little side note there. But okay, so connecting here. So feel your vagina. If you need to do what is a Kegel to feel it, you can. You can move your clitoris to feel a little bit of a Kegel. You can close your anus to feel a little bit of a Kegel, or you can close your vagina. But what I want you to focus on is what happens after the closure. So if you close it, you need to feel that opening immediately and quickly. And that's the tricky part. I only want you to close it just a few times to feel the relaxation, because that's where the magic is. And that's how this baby is going to come out of your body. So that's the first move. So when you do your 5 minutes of breathing a day, you're adding your pelvic floor to this move. So you are inhaling, opening diaphragm, opening pelvic floor. So this is happening, okay? Diaphragm comes into belly, pelvic floor opens. I hope that made sense here. Cool. So that's my first thing. The second tip I want to give you to start releasing at least some of your superficial pelvic floor muscles. So the pelvic floor is actually 3 layers of muscles. And we'll talk about that in just a second. Stat on tearing and pregnancy percent. Oh, thank you for that stat. Amazing. I have to get this reference from you, if that's okay with you. Yeah, that's kind of a lot of tearing. Thank you so much, Mary. I really appreciate that. Fantastic. Yeah. Okay. So back to my next prep exercise for you, really getting the opening of the superficial pelvic floor muscles. So superficial muscles are where people tear. Okay. So usually they tear within this area called the perineal body. There's some kind of tearing there. Some people tear by the urethra or up by the labia. But most commonly people are tearing in this area. Okay. And so in order to help prepare these muscles, give them some blood flow and start that. Also to help separate these sit bones here, because if your pelvic floor is really tight, the sit bones often are pretty tight together. And so to give them some space, I like to teach an exercise that we call the flex X because we don't have another name for it, but I'm going to here, hopefully you can still hear me. Scooting back, you take a pool noodle and you are going to sit on that pool noodle. And this is like a foam roller for your vagina. Okay. You're sitting on it and you're sitting nice and tall. And so it looks like this. It's not an exercise. You might not want to do this at a gym, but so you put the foam roll or the noodle, it's a pool noodle, right between those sit bones. You sit up nice and tall. You can hang here for a couple minutes and then you can kind of lean forward and do this for a couple minutes. Now, my chair is too soft for me. I might need to do it on a harder chair. And this is going to help prep those superficial muscles. While I'm here, I'm breathing into those muscles, thinking about opening them and helping them relax. I might spend 2 minutes in the same exact position, just working on them relaxing. If you feel a burning in this position or on your flex X or pool noodle, then you're just going to keep breathing into it until that burning fades away. So this is a nice way to start getting some blood flow to these superficial muscles. Now, when can you start doing this? Right away, starting the first trimester, second trimester. It's awesome just because you're going to start turning these muscles on, and that's going to be a way that you can lengthen and relax them. The next thing is the only time that I ever really teach Kegling and think that Kegling is important is when you're doing any kind of functional exercise, whether that's getting out of bed or, and I don't teach it as a Kegel. We always teach it as engaging your lower abdominals to lift your bladder. And oftentimes you'll get some overflow to your pelvic floor with that movement. The only time you're actually like Kegling is when you go to like cough or sneeze, then you want your pelvic floor to drive that movement. So pelvic floor contracts to cinch off the urethra so you don't pee yourself or poop yourself or fart when you don't want to fart. So that's when you do it, is when you cough or sneeze. The reason that it's important to use your lower abdominals for the lifting is so if you don't lift them, sometimes when you go to Kegel or use your pelvic floor, you're actually not using it all the way or squeezing it all the way because sometimes your organs are left down. You might have some degree of prolapse, especially while pregnant. It's common for the bladder to sit a little low. Doesn't mean that it's a problem. It's just very common. And so that's why you want to use that lower ab muscle to help pull things up. Hopefully that's coming through here. Cool. So just some side notes. I'm going to talk about a little bit about what therapy looks like and the importance of what's happening from physiological musculoskeletal perspective. So this top left picture, you'll see that diaphragm and you'll see the pelvic floor. Now on the inhale, you imagine that pelvic floor opening and coming down and the diaphragm following, they just follow each other, okay? Some of the techniques that we do that are really important for the external pelvis. In this bottom picture, you see all those white things around the bones. Those are ligaments. We're opening up those ligaments and in stretching those ligaments that can help allow the pelvis to open so the baby can come through more. It also really helps with low back pain or SI pain. And then these are some of the glute muscles that as you get bigger and your pelvis widens, is what I mean by get bigger. As your pelvis changes, your glute muscles tend to get really tight and they will mimic what the pelvic floor is doing. All right, Devin says use your headphones. I will get my headphones on. Is that better? Cool. Okay. So some of the anatomy things that are important from an external perspective. And so if you came to body motion, we spend a lot of time on the external pelvis as well, because if we can change the tone on the glutes and the ligaments, it helps us get through to the pelvic floor a little bit better and feel things a little bit more. All right. So I'm just going to tell you a little bit about why this is so important, why this is my life, and really helping pregnant people has become such a passion to me. And it's because before, when I was practicing as a pelvic PT for, I don't know, 5 years, maybe less than that, maybe my first 4 years as a pelvic PT, were pregnant people, and within the whole physical therapy association within the United States, it was really taboo to treat these muscles internally during pregnancy. I was really disheartened after my first delivery that I had done the biofeedback, which is what a lot of people do, physical therapists do, that like stick electrodes on your pelvis and find out if you're relaxing, contracting. I did that like almost every single day of my first delivery or my first pregnancy. And just like to make sure I had the coordination. We teach this stuff too. It's important, but it doesn't get to the root of these like muscles that actually have to lengthen. And so when I started out as a pelvic PT and as a prenatal pelvic PT, like 99% of most pelvic PTs in this area, they're not doing internal pelvic floor. The Physical Therapy Association recognizes now that internal pelvic PT is absolutely safe after the first trimester. It's safe before if people are having like excruciating pain, but that requires a doctor's note. But anything after that first trimester is definitely okay and needs to be done. So I'm trying to change the game. I want everybody to treat like this. It is such a game changer in allowing babies to be able to come through this narrow space. So I am grateful for my previous experience and grateful seeing different people go through, just working on the external body and working on everything I knew what to do during pregnancy, but that just wasn't enough. And so the minute we started treating internal pelvis and really working on the pelvic floor and lengthening it itself, C-section rates declined so much. And we really don't see a ton of people that end up with C-sections maybe once a year. And it's for, things that can't be controlled. So, it's not in the order I wanted to. So I'm going to go straight into this slide and then I'll go back to having a healthy bowel movement and we'll get into pushing. So the very first thing that some people do to stretch their pelvic floor is called perineal stretching. So that is, here's your vagina. Okay. I'm going to use this as my vagina. I think that's a little bit better. If you can see me here. So here's my vagina. I'm going to say that's 12 o'clock. This is 6 o'clock. You work, perineal stretching is the idea that you pull these muscles, you hold and stretch until the burn goes away, about 90 seconds. And then you let it go, then you find a new spot. There's also a thing called thistles massage, and you can just massage the perineum, the perineal body, and these superficial muscles. Okay. Now the research isn't great on supporting perineal massage, and I think it's because of this reason alone. And it's because they're only focusing on the superficial pelvic floor muscles and not these deep pelvic floor muscles. So let me tell you what happens when we evaluate clinically a pelvic floor. here's the vagina. So now it's a tube, okay? You want that tube to be all on the same level, okay? We do assess the pelvic floor with a finger through the vagina. So that's what it looks like to look at a pelvic floor. And when it's a really tight pelvic floor, oftentimes you can insert your finger in a pelvic floor, but then you have to go up to get to the third layer. So what that means is that a lot of times when people are in labor, the baby is coming down, but they can't come down because the pelvic floor is just so elevated. And so we want to straighten that chute. So all of these muscles, the pelvic floor muscles, are on the same exact plane. And so that's like, honestly, this is the bread and butter of everything we do here, pretty much because no one else is doing it. And it's extremely important for straightening the chute and allowing the baby to have the best chance of sliding through the pelvis. And these are the muscles that tend to be the tightest throughout the entire pregnancy process. And so how we do that is we manually stretch these muscles, get them prepared for the baby coming through. If they're really tight, and the very first thing we do is teach them to relax, but that relaxation might not straighten the chute enough. And so we do a lot of work on opening and like kind of taking it past that limit and overstretching these muscles so they start to develop new lengths in position. So anyone questions on that? Breathing is the first step to this. Using the tube, using your the FlexX is the first step to getting those superficial muscles to release. You can always do some perineal stretching. So is this something that you can't really do yourself? It's hard to do yourself. And this goes back to a question about the wand. And we do not, because going to cervix is contraindicated during pregnancy, we don't ever suggest inserting tools or toys inside the vaginal canal during pregnancy because of stimulating the cervix. So we don't touch the cervix or come close to the cervix or check any of the cervical ligaments during pregnancy. We don't recommend using a tool on yourself. It's hard, especially while pregnant, to do that. You can have a partner help you if they know what they're doing or can like start to find these muscles in your pelvic floor. You can always bring a partner to a session, and a pelvic expert PT can teach them to do this. How often should you start to stretch and when? So we start to, I'll just tell you what we do as far as evaluation. We always evaluate if people come at 12 weeks, we'll start at 12 weeks. We'll do like an initial evaluation. And if someone has a semi-tight pelvic floor or some low back pain, we'll work on that pelvic floor to make sure the back pain goes away and make sure their pelvic floor gets to a good position. That might take 1 to 2 weeks or 3 weeks. And then throughout the pregnancy, we'll really stretch out the visits. So maybe it's once a month. And as you get close to the end, maybe things are kind of closing back up. And so to help them stay open, it might be weekly for 4 weeks, or weekly for 8 weeks. Some people come every single week of their pregnancy for prevention. So that's usually what the time frame looks like. It just depends on what your pelvic floor is like and what it was like. A lot of people, any history, so people who were really athletic, who have athletic backgrounds, work out a lot, oftentimes really have tight pelvic floors. People who have very hypermobile joints, so they're extremely flexible, often have very tight pelvic floor. People who have tight hips often have very tight pelvic floors. If you have something like painful intercourse, or intercourse is uncomfortable, or you get pain with deeper thrusting movements, a lot of times that means that you have a lot of tightness within the third layer of the pelvic floor. So these are all just things that we take note of in history. That's why a consultation with us is pretty nice, because we can just note some of these things and we see the patterns really just of whatever you do in your life. And maybe it's great and we're like, oh yeah, you're not going to need much, or but really that consultation can help guide us on what you would need as well. So as far as stretching, usually we stretch, I don't know, say as far as like a number of visits or number of times, it doesn't take that much to learn how to use this muscle and learn how to get it to that stretch position. So probably pregnancy wise, the average number of our client comes is 8 to 12 times. And that's 8 to 12 times of stretching these muscles. And that's not that much. So it doesn't take that much to start creating this new space in the muscles. And then you get to reinforce that space with breathing and learning how to use it. Okay, so I'm going to go back to bowel movements. Oh, I'm stuck on my screen. Oh no. Okay, back to bowel movements, and then we'll go back to pushing. Sorry, I'm running a little late on time. I'm sorry, you guys, if you have to run. I'll try to get through these next few slides pretty quickly. Um, but here we go. So bowel movement wise, so to have a healthy bowel movement, the reason I'm discussing this with you is because it's the initiation of what should happen for a healthy pushing of the baby. So having a healthy bowel movement is important because it decreases the pressure on the pelvic organs. So constipation is common during pregnancy. And if you're constipated, you should work with your provider and a pelvic PT to really make sure that you can manage that pressure. So there's not a lot of pressure that's pushing the organs out. So that's just a side note, but here we go. So breathing, you start your bowel movement in this flex position. So I'm bending forward, or you can use a squatty potty. Squatty potties bring your legs up. Okay. So they bring your legs elevated. So your knees are above your hips. Squatty potties can be a little uncomfortable while pregnant because some people might not have space to bring their legs up. So it's nice to just spread your legs as far as you need. Let that belly be there. And when you're flexed over like this, what it does is it straightens the chute of the rectum. So it improves the passage of stool. So you don't have to strain. It's going to help prevent hemorrhoids and anal fissures that are really common during pregnancy. So you're in this position here. You're going to take a nice deep breath using your diaphragm and then let it go. You take 3 of those breaths. And on the third one, you're going to bear down and you try and fart. It's like a fart that you don't want anyone to see you farting. So you're not like using your body. You're just trying to have a little fart and you don't want people to see you farting. So that's the kind of bearing down that you want to try and get. So you're inhaling into belly 3 times. On the third one, you're gently bearing down. And you're not holding your breath for this. You're at the top of the inhale is when you start your bearing down, but you continue to exhale as you bear down. Okay. So everyone understand how to have bowel movement? Does that make sense? You're using your breath because that's helping stimulate the peristalsis. So this is my right side, but I think it's flipped on the screen. So my right side to the left, that's how the stool moves through the colon. When you use your breath, it helps stimulate moving that stool along. So you're just getting free movement, free peristalsis without having to push it out. This takes dedication to actually sit on the toilet and do, especially if you have kids running around, but it's awesome. It's important to like make yourself do this. Teach your partners how to poop like this. Teach your kids how to poop like this. I think the most pelvic floor problems we have is because we've been straining to poop our whole lives because we're pooping through really tight pelvic floors. So start teaching your kids to poop like this and life will be better for them. Okay, so let's go back to pushing. This might be controversial for some people. Some people believe that you push a baby out. Some people don't. There's like the fetal ejection way to get the baby out where the baby just comes out of your body. And wouldn't that be nice if that's where we all were? But a lot of times you're cued to push, especially in the hospital setting. You might be cued to push. In a midwifery setting, you might be cued to push. You might have a need to just get the baby out right away because maybe the baby's heart rate is decelerating and people are telling you to get this baby out of your body. Or not, and I don't agree with those fear tactics, but this is just what happens, right? So when we talk about pushing, the best way to push, and there is mixed research on this, I'm going to say what people do often and what I see. This is how I was coached during my first birth, how to push. You hold your breath and you bear down for 8 to 10 seconds and you just give it all you got. Okay. So that is closed glottis pushing. That is not breathing. And that is just pushing with all your might. You are going to have a lot of broken blood vessels. At least I did when I did that. And that kind of pushing leads to more tearing. That's shown in the research. And so in order to help protect your pelvic floor and decrease some of that tearing, we like to teach open glottis pushing. And when you do a nice deep breath, so if you inhale into belly, and then if you exhale and you do like a really deep voice, like, what happens is your vocal cords, they open. So your throat opens really deep. Wow. When your throat opens and those vocal cords open, your vagina opens. And so with those deep tones, your vagina can open. Now, often this needs to be coordinated. And I suggest that you at home practice like doing that voice and seeing if you feel that pelvic floor open when you do that. Because some people have patterns that are mixed up. Ideally, this is what's happening though. You can do an and your pelvic floor opens. Now, if you do a really high pitched voice and sound, you might play with this and you might feel that your pelvic floor really tightens when you do this. And so, um, that's the effect of the neck and the glottis on the pelvic floor. So if you have a tight neck, you probably have a tight pelvic floor. And so those are very connected and you should get some help with that too. But this is me just teaching some pushing. So if you use that technique like that technique, you should feel vagina open, okay? So how we like to teach pushing is simply breathing the baby out of your body and still pushing. But if you push, so if you inhale into belly using that nice diaphragm that we've practiced this whole webinar, you're inhaling into belly, exhaling at the top of the inhale, you inhale again, and then you bear down so I'll start to push at the top of my inhale. So inhaling, top of the inhale, I'm going to initiate the push, but I do not hold my breath. And if you want to, you can do the to try and bear down and give downward pressure. That is going to help push the baby out without breath holding. So that's how we teach it. That's more protective for the pelvic floor. It's better for your pressure system. You're using some of your abdominal muscles when you do that, but you're really focusing on keeping the glottis open so the vagina can stay open. Now, again, you might not feel like you have this coordination, and that's time like you need to see a pelvic expert PT to get that coordination, and your pelvic floor might be too tight that it can't open, or the opening it's getting is not enough. So I'm giving you these tips, but I'm telling you like the essentials of you want to make sure that that third layer is really open and make sure that it's coordinated with your breath. You might feel like it is, like I did during my first birth and labor, but it doesn't necessarily mean that it's opening all the way or getting to that full relaxed position. Okay. And all the work you do now, even if it's a stretch to get to a pelvic expert PT, the people that we work with that come during pregnancy have like not even a third of the healing time postpartum. It is just incredible when you restore that, when you get that range of motion in the pelvic floor muscle, when it can do this and it has so much blood flow going, even if you tear, that healing time is so quick and your core feels like it just comes back together right away. The pelvic floors that we feel after birth, after going through our birth prep program here at Body Motion, is when we feel in postpartum, we're like, did you even have a baby? Like it just feels like butter. Like it's like nothing's wrong. Your core is just working and fine. And we just make sure those muscles are coordinated and then they're on their way. And usually it's a much, much quicker healing time. Now, the problem is, insurance doesn't pay for this. Insurance doesn't pay for prevention. You can try to get reimbursed from your insurance, but this is all about preventing injury. Insurance pays for injury. So, okay, now this is the best part, and I'm running really late. I'm sorry if you have to go, but this is the role of orgasms, and I'm just throwing this out there because to me it's important to talk about orgasms. Now, if you have painful orgasms or difficulty getting an orgasm or have never orgasmed, that could be a sign of pelvic floor dysfunction. It's nice to try an orgasm. Again, you're not doing this if you're on pelvic rest. But when you orgasm, you get involuntary contractions of your pelvic floor. So you are getting some Kegel, but it's healthy and should fully relax. And it also stimulates your uterus to get some contraction. And so those are like free practice for labor. And so I suggest that everybody work on orgasming through their pregnancy to really help with the blood flow and help train your uterus to start to contract. So it's not part of pelvic PT, but if you do have problems with orgasm or difficulty attaining orgasm, it's important that you seek help. And now the more you practice, the better, because you'll be able to, if you have trouble getting one, practicing is good. Also, just for reference, most people don't have vaginal orgasms. They have clitoral orgasms. And people that do have vaginal orgasms, it's just because they're rubbing the clitoris from the inside of the muscles. So the clitoris is simply just a couple muscles put together. And it's because they're stimulating it from the vaginal canal. Most of the time, it's because you're stimulating from the external, just for a side note. So it's healthy and good to do that while pregnant as a free birth prep for you. And then you get to know your own vulva. And what's better than that? Because the baby's going to come out of there. Might as well learn how to use these muscles. So a couple other rituals, just to talk about exercise a little bit. Um, you know, Pilates, yoga, boot camp, CrossFit, everyone's, those are really trendy. I guess not necessarily so much after COVID. But what's important is not necessarily whatever you're doing for exercise, it's what's activating when you're exercising. So is your lower abdominals, your transverse abdominis driving the movement? And is that active when you're working out? And can it relax? And can your pelvic floor relax? And so just making sure you have that range of motion and have that contraction of your core, then that will make things like yoga safe. So you're not pushing past any extremes. And then of course, the work of seeing a pelvic expert PT and really making sure that you have someone helping your pelvic floor open and relax, helping your glute muscles open and relax, helping your ligaments open and relax. That will help the pelvis expand as the baby comes down for birth. So cool. So who benefits from pelvic floor PT during pregnancy? Every birthing person does. So if you know somebody that's pregnant, send them this webinar, or, send them our way. I highly, highly recommend that you at least talk to a pelvic expert PT, talk about what you're experiencing. Low back pain, like I said, can resonate as relief type pelvic floor. Your whole pelvis is shifting. And so your pelvic floor is trying to compensate for that. Pelvic pain. So if you have pain in the front of your pelvis, sometimes people call it lightning crotch. It's that pubic symphysis pain or rectal pain, tailbone pain, anything like that. Peeing your pants while pregnant is not normal. And so it's not normal. It's very common, but it's not normal. So it doesn't have to be your norm. And it's just a sign that the pelvic floor isn't functioning. So definitely give it help. And then, yeah, that's about it. Tinkling arms and falling asleep. These are just things that can help, pelvic PT can help with during pregnancy. So cool. Thank you. These are some of my references. And yeah, any questions? Oh, we finished right on time. So I'd love if anyone has any questions. I think I answered them as we were going along, but feel free to drop any in there. I wish you guys the best. And just as a side note, before we wrap, it's really important that if you have a doula, which the doulas are amazing, that you talk with them about your plans to maybe push, or you talk with them about how you want to breathe and how you've been working on opening up your pelvic floor. I just had a patient recently who went into labor and she'd been working so hard for her VBAC and really working on opening the pelvis and breathing the baby out, and then realized that her doula was cueing her to hold her breath, and so was everybody in the hospital room. And so it was really good that she advocated right away. She's like, no, I'm breathing this baby out, and the doula supported her. But it's really important to make sure that you have that communication with your birth team, that this is how you're going to do it. And if that's how you want to do it. So of course it's up to you and what feels best for your body. But just a side note there. Thank you guys. Devin posted our birth prep program, which is on sale right now if you're interested. So we'd love to have you come in for a consult. Dr. Victoria and Dr. Riley are the ones who are treating patients currently. I am currently on maternity leave and just working in the business, but you'll see me here. Cool. Glad. Awesome. Glad it was helpful. If you have any questions, please, 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 you can reach out anytime. We love to help you and be a part of your birth journey and pregnancy journey. Cool. Thanks, guys. Thank you. Thank you, Ashley. Awesome. You guys are wonderful.